Okay, let's dive in. Imagine this tiny insect, right? Something you'd barely swat away.
Hmm.
And it turns out it's the sole carrier for a parasite that can cause, well, devastating harm to your pet's heart and lungs.
Yeah, it sounds dramatic, but it's unfortunately very real. We're talking about heartworm disease.
Spread just by mosquitoes. It's kind of wild.
It is. And this isn't, a minor thing. Heartworm disease, the actual parasite is Diagnostic immitis. It's a serious progressive illness.
And it mainly hits dogs, but cats and ferrets too.
That's right. Dogs are the main host, but cats and ferrets can definitely get it, and it leads to severe issues in their heart and lungs, their whole cardiopulmonary system.
So today we're really digging into this. We're working from an article called Understanding and Preventing Heartworm Disease in Pets.
Hmm.
And our goal really is to make sure you feel fully informed. Like, what is heartworm? How does it spread? That life cycle is something else.
It really is.
How it looks different in dogs versus cats, how vets figure it out, how they treat it.
Which is complicated.
Right. And most importantly, how you can prevent it, which sounds much, much easier.
Absolutely. We want you to have the knowledge, understand the risks, and, feel confident about protecting your pets.
Okay, so let's start right at the beginning. Fundamentally, what is heartworm disease?
So at its core, it's an infestation. This is a specific worm, Diagnostic immitis.
Okay.
But the absolute key thing, the part that sets it apart from lots of other parasites, is how it spreads. It only happens through the bite of an infected mosquito.
Only. So not like dog to dog or
No,
cat to cat.
no, absolutely not directly contagious between pets. The mosquito is the essential middleman, the vector.
That's such a critical piece of info right off the bat. The mosquito isn't just a nuisance, it's the only way.
Exactly.
And once it's transmitted, where does this parasite decide to live? Where does it set up shop?
Its target zones are the heart, the lungs, and those major blood vessels connecting them, especially the pulmonary arteries.
Ah, okay.
And having worms living there, well, it causes significant inflammation and physical blockage, too.
And I imagine that inflammation, that blockage, leads to some pretty serious problems down the line.
Precisely. Over time, you're looking at major lung disease. The heart can enlarge and start to fail. And you can even get damage to other organs because blood flow is messed up.
Which, okay, leads us perfectly to the next question. How does a mosquito bite actually turn into adult worms chilling in the heart? The life cycle sounds intricate.
It is quite a journey, yeah. And a bit unsettling when you break it down. It all starts when a mosquito bites an animal that's already infected.
Okay, an infected dog, for instance.
Right. And it sucks up blood that contains microfilaria. These are the microscopic sort of baby worms, immature worms.
So the mosquito drinks the babies. Then what happens inside the mosquito?
Well, those baby worms aren't immediately ready to infect another animal. They need time inside the mosquito, usually about 10 to 14 days. Temperature plays a role to develop into what we call infective larvae.
Ah, so the mosquito is like an incubator.
Exactly. It's a necessary step for the parasite's development.
Okay, so the mosquito's done its part, the larvae are ready, then it bites a healthy pet.
And injects those infective larvae right into the new host's bloodstream while it's feeding.
And do these larvae just like immediately swim to the heart? Or is there more to it?
Oh, there's more. They don't just stay put. Over the next, say, 6 months or so, that's the average.
6 months. Wow.
Yeah. It takes a while. They migrate through the host's tissues. Their final destination is the heart and lungs, specifically those pulmonary arteries. That's where they finally grow into adult worms.
Adult worms, ready to reproduce.
Yep. And the source mentioned, they can get pretty big. Females up to a foot long.
It's kind of horrifying, isn't it? 12 inches inside your pet's heart and lungs.
It is a shocking image. And once they're mature, they mate. And the females release a whole new batch of microfilariae back into that animal's blood.
Completing the cycle.
Exactly. Making that pet a new source for mosquitoes to pick up the infection.
And these adults, they stick around for a long time.
They do. In dogs, they can live for 5 to 7 years. In cats, it's usually shorter, maybe 2 to 3 years. But still, that's a long time for an infestation.
That's a significant chunk of a pet's life. And the impact must vary a lot.
Absolutely. It depends on how many worms there are, how long the infection's been going on, the pet's overall health, and crucially, whether it's a dog or a cat.
Which brings us to a really important point the article makes. The symptoms look quite different. Dogs are called the natural host, What does that mean for how the disease shows up in them?
Right. Natural host means the worm completes its life cycle more easily and successfully in dogs. So they tend to get higher numbers of adult worms, and the disease often progresses through somewhat predictable stages if it's not treated.
Okay, tell us about those stages in dogs. What should people look out for?
Well, in stage 1, the earliest phase, you often see nothing.
No signs at all.
Often, no obvious signs. The infection is there, but it's subclinical. Then stage 2, you might start seeing mild symptoms. Maybe a slight cough now and then.
Something you could easily miss.
Definitely. Or maybe they just seem to get tired a bit quicker after playing. Again, easy to overlook.
Okay, so it sneaks up on you. What about stage 3?
By stage 3, things are usually more noticeable. The cough is likely more persistent. They might show real fatigue. Even after just moderate activity, weight loss can happen, trouble breathing.
Serious signs.
Yeah, and a vet listening to the chest might hear a heart murmur develop around this stage too.
And then there's stage 4. The article calls it Cavall syndrome. That sounds bad.
It is. It's a genuine life-threatening emergency. Cavall syndrome happens when there's a huge number of worms and they physically block blood flow back into the heart.
Oh, wow.
So you get sudden, severe symptoms, labored breathing. Their gums might look pale or even bluish, sometimes dark, like coffee-colored urine, and they can just collapse.
Goodness.
It requires immediate, rush to the ER intervention, often surgery, just for a chance of survival.
That progression from nothing to a sudden crisis is incredibly stark. Really drives home why catching it early matters.
Absolutely.
Now, cats are different. Atypical hosts, the article says. How does it look in them?
Yeah, it's a whole different ballgame in cats. Usually, far fewer worms actually make it to adulthood. Sometimes none do.
So fewer worms, maybe less severe?
You'd think so. But actually, even just a few worms, or even the immature larva, can cause a lot of inflammation and damage in a cat's lungs. It's a condition sometimes called hard heartworm-associated respiratory disease.
And the symptoms aren't the typical heart failure stuff?
Not usually, no. Early on in cats, it often looks a lot like other respiratory issues. Think asthma or allergic bronchitis. So
Okay.
coughing, wheezing.
They might treat as allergies.
Exactly. And interestingly, vomiting is a surprisingly common sign in cats with heartworm disease.
Vomiting, that seems completely unrelated.
I know, it's one of those weird atypical things. Pet owners might just think, oh, hairballs again.
Ah, okay, what else?
They might also just have periods of being lethargic, maybe lose some weight, not eat as much. But here's the really tragic part the source highlights. For some cats, the very first sign you see is sudden death.
What? Just no warning.
Sometimes, yes. Even just 1 or 2 worms dying off can trigger a fatal reaction in the lungs. It's devastating.
Wow, sudden death is the first sign. That's incredibly sobering.
It really is.
Okay, so given these symptoms can be subtle or non-existent or mimic other things or even just be sudden death, how do vets actually diagnose this, especially early on?
Well, diagnosis is usually a combination of things.
Yeah.
Looking at clinical signs, if there are any, but heavily relying on specific tests. Since so many pets don't show signs early, routine screening, particularly for dogs, is just so important.
Right, catch it before it gets bad. Let's break down the dog diagnosis first. What tests are common?
The main one for dogs is the antigen test. This blood test looks for proteins that are shed by adult female heartworms.
Okay.
It's very accurate for established infections, but there's a catch. The worms generally need to be about 6 months old for the test to pick them up.
Ah, so it won't catch a really recent infection.
Correct. That's why vets often also do a microfilaria test. That's looking directly under a microscope at a blood sample for the circulating baby worms.
Okay, looking for the actual baby.
Right. If you see microfilaria, it confirms you have mature, reproducing adult worms. Using both tests give the better picture in dogs.
And imaging, like x-rays.
Definitely. Chest x-rays are really useful to see if there are changes in the heart or lungs caused by the worms. An echocardiogram, that's an ultrasound of the heart,
Right?
that can sometimes actually let the vet see the worms inside the heart or pulmonary arteries, especially if there's a lot of them. Plus, regular blood work helps check overall health.
Okay, so a multi-pronged approach for dogs. What about cats? You mentioned antigen tests aren't as reliable.
That's a really key difference, yeah. Because cats often have so few adult worms, or maybe only male worms, the antigen test can miss infections a false negative.
So what do you do then?
So for cats, vets often rely on a combination of the antigen test and an antibody test.
Antibody test, what does that show?
The antibody test detects the cat's immune response to being exposed to heartworm larvae. So it can be positive even if there aren't adult worms present right now, or if the antigen test is negative. Using both together gives a better shot at diagnosing cats.
Makes sense. And imaging must be even more important for cats then.
Yes, arguably more critical. X-rays and echo are vital for assessing those lung changes, that heart condition we mentioned, and checking the heart. Sometimes you could even spot worms on an ultrasound in cats, even with just a few.
Any other tests for cats?
The article mentions something called bronchoalveolar lavage, BAL. It's not super common, but it involves collecting fluid from the airways. It can sometimes help tell the difference between hard and, say, feline asthma.
Okay, so diagnosis is definitely tricky, especially in cats, which leads us to treatment. The source called it complex, costly, and risky. Doesn't sound fun.
No, it really isn't. You want to avoid getting to this stage if at all possible. The goal is to kill the worms and manage the damage, but it's a long, drawn-out process with potential dangers, especially the dog treatment using the adulticide drug.
Right, let's talk about treating dogs first. What's involved?
It's definitely a multi-step thing. If a dog is already really sick from the heartworms, like in heart failure, they need to be stabilized first. That might mean hospitalization, oxygen, other meds.
Before you even start trying to kill the worms.
Exactly. Then there's usually a pre-treatment phase. This often involves giving an antibiotic called doxycycline for about a month.
An antibiotic, why?
It's fascinating, actually. It doesn't kill the heartworms directly. It kills symbiotic bacteria called Wolbachia that live inside the heartworms.
Bacteria inside the worms.
Yeah. And killing these bacteria weakens the worms and, more importantly, reduces the inflammation that happens when the worms die later.
Yeah.
Makes the next step safer. They also often get steroids, like prednisone, to help with inflammation.
Wow, okay. So you prep the dog, weaken the worms, then comes the main event, the drug to kill the adults.
Right. That's the adulticide therapy. The drug is called melarsomin dihydrochloride. It's actually an arsenic-based compound.
Arsenic?
Okay. Yeah. It's given by deep injections into the back muscles. The standard way is usually a 3-injection protocol spread out over several weeks
Why spread it out?
to try and kill the worms more gradually. If they all die at once, it increases the risk of serious complications.
And what are those main complications? What's the big risk during treatment?
The absolute biggest concern is thromboembolism. That's when pieces of the dying worms break off and travel to the lungs, causing blockages in the pulmonary arteries.
That sounds incredibly dangerous.
It is. It can cause severe respiratory distress, even sudden death. And that's why exercise restriction is so incredibly important during the entire treatment period and for weeks after.
Like zero running or jumping.
Absolutely zero. Strict cage rest, or maybe just short leash walks for bathroom breaks only. Any exertion increases blood flow and the risk of dislodging those worm fragments. It's tough on the dog and the owner, but it's critical.
Wow. Okay, so manage the dying worms, restrict activity. What happens after the adulticide shots are done?
Well, after the adult worms are hopefully killed, the vet will usually give another medication to get rid of any remaining microfilariae, the baby worms still in the blood.
Right, clean up the cycle.
Exactly. And then, typically about 6 months after finishing the adulticide treatment, they do another antigen test to confirm the infection is actually gone. It's a long haul.
It really sounds like it. Now, for cats, the article is stark. And no approved adulticide treatment. Why not?
Yeah, this is a really tough part for cats. The risk of those fatal thromboembolic reactions, the blockages from dying worms, is just considered too high in cats with the drugs we currently have.
Because their arteries are smaller or they react differently?
Both, really.
Yeah.
Their pulmonary arteries are smaller, and their inflammatory reaction to the dying worms just seems to be much more severe, much more dangerous than in most dogs.
So, what can you do for a cat with heartworm? Is it just managing symptoms?
Pretty much, yes. Treatment for cats is largely supportive care. The main goal is managing the inflammation, especially in the lungs. So corticosteroids like prednisolone are often used long-term to reduce that inflammation and help with the coughing and breathing issues from HARD.
And if they have trouble breathing?
Bronchodilators might be used sometimes. If a cat goes into a severe respiratory crisis, they'd need hospitalization, oxygen therapy, IV fluids, that kind of supportive care.
Is surgery ever an option? The article mentioned it briefly.
It mentions surgical removal via the jugular vein, but it emphasizes that this is rare, risky, and definitely not a common procedure. It's usually reserved for specific cases at specialty centers, if at all.
So for most cats, it's about keeping them comfortable and monitoring.
Yes. Regular checkups, maybe repeat x-rays or ultrasounds to track the disease, and managing symptoms with medication, basically hoping the cat can outlive the worm's natural lifespan.
Okay, wow. So summing all that up, treatment is hard, it's expensive, it takes months, involves strict confinement for dogs, carries significant risks, and for cats, there isn't even a cure, just management, with that risk of sudden death always looming.
That's a pretty accurate summary. It really paints a clear picture, doesn't it?
It absolutely does, and it leads directly to what the source and basically all vets emphasize constantly.
Prevention.
Prevention. It's got to be vastly better than going through all that.
Oh, incomparably better. Safer, simpler, much less stressful for the pet and the owner, and far, far less expensive than treatment.
And thankfully, there are lots of effective options out there now.
Yes, absolutely. We have really good preventatives. There are monthly chewable tablets, topical liquids you put on the skin, even injections that can last for 6 or 12 months.
With familiar ingredients like ivermectin, milbemycin, moxidectin, selamectin.
Yeah.
Lots of brand names out there.
Exactly. There's usually a good option for almost any pet and owner preference.
Now, is it true dogs need a test before they start prevention?
Yes, that's crucial. Any dog over 6 months old must be tested for heartworm before starting a preventative medication.
Why is that so important?
Because if a dog already has adult heartworms, giving certain preventatives can cause a rapid die-off of the microfilaria, the baby worms, which can sometimes lead to a severe shock-like reaction. You have to know their status first.
Okay, safety first. And even if your dog is on prevention year-round, vets still recommend testing them every year. Why do that if they're protected?
Think of the annual test as a safety check. It confirms the prevention is working effectively. Maybe a dose was missed or vomited up, or maybe there was a rare case of resistance or product failure.
Ah, like a quality control check.
Exactly. Catching an infection early, even a breakthrough one, is always better than letting it become established. It provides peace of mind.
Makes sense. Okay, here's a big one I hear all the time. What about indoor pets? My cat literally never sets foot outside. Does she really need prevention?
That's probably the single biggest misconception that puts pets at risk. The answer is yes, absolutely.
Even strictly indoor ones?
Yes, because mosquitoes get inside all the time. Through open doors, windows, tiny tiers, and screens. They can even hitch a ride on your clothes.
Huh. Never thought about hitching a ride.
It happens. And it only takes one bite from one infected mosquito carrying those infective larvae. That's it.
So indoor status is not reliable protection?
Not at all, especially in areas where mosquitoes are common. Consistent, year-round prevention is recommended for all dogs and cats in endemic areas, regardless of lifestyle.
That's a really important message for everyone listening. Don't assume indoor means safe.
Please don't. Prevention is the most powerful tool we have for controlling this disease, hopefully even eradicating it eventually. And the best first step is always talking to your veterinarian.
Right. They can help you choose the best product.
Exactly. Based on your pet, your lifestyle, where you live, they'll tailor the best prevention plan.
Okay, so wrapping up this deep dive, the main takeaway seems crystal clear. Heartworm disease. Serious, potentially deadly, spread only by mosquitoes, with a complex life cycle, really difficult and risky treatments, especially for cats who lack a cure. But the huge positive takeaway is that it's overwhelmingly preventable.
That's the key message. Protecting your pet really comes down to understanding this threat, knowing that all pets are potentially vulnerable.
Even the indoor couch potatoes.
Even them. And then taking that simple proactive step. Consistent prevention and regular testing, guided by your vet.
So here's a final thought for you to chew on. After hearing all this, the reality of foot-long worms, Cavill syndrome emergencies in dogs, sudden death in cats, the risky, expensive, difficult treatments, does knowing the full picture maybe shift how you view prevention? Does it make that monthly chew or topical or that annual shot feel less like a chore and more like, well, a simple act of profound protection for your furry family member?
Something definitely worth considering.